Alright, so this is the head and face exam. So the first thing I'm doing is just examining the shape of the skull and the size of the head in proportion to the body, looking for things like acromegaly. And then I'm looking at the head in position to the neck, looking for things like torticollis. Then I'm looking at the face shape, color, any skin conditions, such as scars or masses, edema, like Cushing syndrome or anything like that. He looks fine. I'm also looking at the shape and symmetry of the eyebrows, nose, and mouth, looking for things like hyper or hypothyroidism. Then I'm also gonna examine the skull, looking for things like lice or scrapes on the head. I would actually have gloves for this part, but I don't. And then I would also palpate the head for any, see if there's any tenderness or swelling. And there's not, so he's good. I'd also look at the parotid gland, which is under the earlobe, above the angle of the jaw, looking for any swelling. And that feels fine too. And then I would also percuss his maxillary and frontal sinuses. Any pain with that?
No.
Any pain?
No.
Any pain? No. Okay. And then I'm also going to listen for any bruits in the temporal and orbital arteries. And then can I have you take off your glasses and close your eyes? Those all sound good. The next thing I'm going to test for cranial nerve 5. I'm going to put this on the left side. No, you can just bite down on it. Good. And then right side. Good. And then I'm also gonna look at the eye. So I'm gonna have you, I'm just gonna hold open your eyelid here and you can look that way. Good. And then I'm gonna do this side. And I would switch the thing. You don't wear contacts or anything?
Not
right now. Then I'm gonna have you look to your left. Good. Any pain with that?
No.
No? Okay. And then I'm gonna assess cranial nerve 7. I'm gonna have you wrinkle your forehead. Okay. And then I'm gonna have you puff your cheeks. And then can you frown and smile? Good.